Shubha Madhyana, everyone. I'm Dr. Shilpa. On behalf of National Institute of Clinical Excellence Homeopathy, I warmly welcome all of you for today's session. Today is a memorable day for all of us as we are starting with the 6th batch of Metamorphosis today. And this Metamorphosis, that is Diploma in Advanced Classical Homeopathy, we would be starting from next Wednesday. So before we start, we are having one formal orientation session today with an interesting topic that is glimpse of classical homeopathy. Before we actually get into the topic, let us briefly see what our institute is about. So our institute was established in the year 2013 by Professor Dr. H.L. Swami. The sole motto of our institute is to teach the effective practice of classical homeopathy according to the principles laid by Master Hahnemann. And we have been doing all this through our regular workshops that we are doing. And also we are taking core homeopathic subjects as a topic of our workshops and regular courses. So till now, we have successfully completed 5 batches of Metamorphosis and 2 batches of advanced course, that is thyroid disorders and diabetes management. Meanwhile, we are also been conducting workshops like homeopathic dermatology, utility in utility of intercurrent remedies in homeopathic practice. And recently, under the banner of Class 2 Clinic webinar series, we have started to conduct again same workshops. And rare remedy and uncommon prescriptions was the first under this banner. So, and today we are here to know about Metamorphosis. So Metamorphosis is the identity of our institution. That is in a short time, that is 6 months to 8 months, we are trying to train and transform the practitioners to practice classical homeopathy. So all of us know that what we have learned in college is essential, but same is difficult to put into practice in our clinic. So what that journey from college to the actual clinical practice is the training that happens here. So it is an opportunity to upgrade your clinical skills and to boost your confidence in the practice. And I can say the whole program is a complete package for the one who wishes to practice homeopathy through a classical way with no compromise on the core principles laid down by our master. So, and this year the course will be around the duration of about 80 hours spread across from June 2022 to December 2022. And sessions will be afternoon every Wednesday. That's a weekday afternoon between 2:30 to 5 p.m. And I'll just share the tentative modules and the session details, and the small changes in this timetable can happen. Okay. So I'll quickly run through the session details. So we would be starting next Wednesday with the module 1, which is related to perceiving the case. So in that we have 3 sessions, like case taking, the patient view versus doctor's view, understanding the patient, not just the disease, picking up diamonds from the dust. And the second module would be repertory module. Here we would be teaching different methods of repertorization. First session would be related to Kent repertory, followed by Bonninghausen's method of repertorization. And next session would be other small repertories, their usage in repertorization in acute and chronic cases. Our third module will be Materia Medica module. So the first session would be Secrets of Materia Medica and diving into the ocean of Materia Medica. And we would be discussing Plant Kingdom and one remedy from Plant Kingdom, followed by Animal Kingdom and its remedy, Mineral Kingdom and one remedy from that kingdom, nosodes, sarcodes, and imponderabilia. Followed by the module related to miasms. Here we will see history, mystery, and chemistry of miasms, and understanding each miasm in detail. That would be taken in 2 sessions. Then we would be taking 3 sessions related to tri-miasmatic remedies. Next module would be, the sessions would be remedy reaction, the constitution, temperament, and diathesis, susceptibility, suppression, and one-sided diseases. Followed by module 6, posology, part 1, part 2 would be dealt with. Then we'll have live case discussions for about 15 hours, followed by management of acute diseases, indications of rare remedies, role of homeopathy in epidemic, pandemic diseases, and open discussion. So I guess like a whole 5.5 years, what you have done in your BHMS would be taught in taught in next 6 months duration, and the whole thing would be clinically oriented and practical sessions. I would now stop the screen share. You're still seeing my okay. Dr. Archana, but you are here?
Yes,
yeah.
Doctor.
Yeah. So I would now request Dr. Archana Bhatt, who are a successful homeopathic couple, and she has attended our previous Metamorphosis classes. And Archana Bhatt, after attending the classes, what is the difference that you are feeling? And do you please, can you please share your views on the course?
Namaste. Good evening, doctor.
Good evening.
I am Dr. Archana. I practice in Malaysia 17th class. I was in 2018 Metamorphosis batch. So for us, all classes were offline only. And every weekend we used to wait for the Sunday to go and attend the class. It was like exactly after my maternity leave, I joined Swami Sir's classes. So it was a refined brush up of all the homeopathic subjects. Like how Dr. Shilpa now read about all the modules. Sir has designed every class mainly for clinical orientation only. Like it gave me a good confidence to go back to my clinic. So after 2.5 years of gap, like theoretically what he explained in the class, we got a chance to see them practically also. Like we used to bring one new cases from our clinics only, like which was struck or which we felt it was difficult, and sir used to take the case in front of us only. So it was like the case taking, case perceiving, like everything theory what he explains, and we used to see that only. And also he gave us opportunity to sit with him in his OPD. This you don't get in any course. Like in OPD also every case has a follow-up. What he taught in second prescription, potentization and repertorization, and also the repetition of drugs. So these all what he taught in theory, we used to see in the in his OPD also. So it was like reconfirmation, and it used to tune us our clinical skills. And my best two subjects, which in every case now also I remember Swami Sir's words, sir, like second prescription and this one, intercurrent drugs, which I was not at all knowing. That gave me confidence to give intercurrent drugs in chronic cases. And even now, after seeing Sir's OPD, I started using biochemic tissue salts also. I used to give just placebo before. So after selected remedy. So now even biochemic in every case I'm using. So that's it. Like you'll get both the clinical, like practical and theory experience in the course. That's what. For us, only one topic, Ophidia, Dr. Patel sir took us. Only that one, and Ophidia, different experience we had after Dr. Patel sir's class. And now I'm happy that even Dr. Hegde sir is in teaching faculty. So that's it. Like you'll get a good experience of and also a clarity, in-depth clarity about whatever you learned in 5.5 years. It will be like still more tune your skills. That's for sure. And I just inspired by sir's love for teaching. So I remember Swami sir for that only every time. So thank you, sir. Thank you for like I thank my junior, Dr. Ramya. She referred me for this course. So I just thank her for that also. Thank you.
Thank you so much, Dr. Archana, for all the lovely words that you just shared with us. And this would be actually very inspiring to all the new participants who have joined the course. Thank you so much.
All the best for the new batch. Yeah.
Thank you. Thanks on their behalf.
Something wrong? A lot of voice is getting stuck in between. We are not able to hear it.
Is it, Dr. Trupti, is it same with you also?
It's coming clear.
For me, it was clear.
Loud, yeah, it's a little loud. It's clear.
Suddenly the voice got stuck.
Okay.
For a few minutes, few seconds, we are not able to hear.
Okay. Dr. Trupti?
Yes.
Yeah. Can you please introduce our faculty, Dr. Shripad Hegde, sir?
Dr. Shilpa, you can open the slide.
Yeah.
Good afternoon, everyone. A warm welcome. And it gives me immense pleasure and big honor that get an opportunity to introduce our faculty, Professor Dr. Shripad Hegde. Sir is the president of Karnataka Qualified Homeopathic Doctors Association. He's a director at Tattva Homeopathic Research Center. He was a former professor at Government Homeopathic Medical College and Hospital, Bengaluru. He has over 36 plus years of clinical and teaching experience. He's a renowned national and international speaker and has presented almost more than 35 scientific papers at both national and international conferences. In his clinical practice, he has been seeing many cases, right from acute to chronic, pathological cases, number of pathological cases, cancer cases, end-stage disease cases, like the number of cases, you name the disease and you would have seen it in his clinical practice. And it is a good, big opportunity for us to learn from him and gain all the knowledge that he has in his clinical experience. So it is going to be a wonderful journey in this metamorphosis to learn from Dr. Shripad Hegde, sir. Sir, over to you. Hegde, sir.
A very good afternoon. Am I audible?
Yes, sir.
Yes, sir.
Yeah, I am very happy to see you all. And back in the banner of nice. And we are going ahead with the sharing, caring, and learning. See, in the process of learning, it never ends. And whatever we go on learning, we feel that we know less. And there are more things are there to learn and study. See, even after the so many years of experience of teaching and practicing, still I feel that I have to know many things where the subject as well as to know the things are like ocean, and it is very difficult to understand as well as digest it and put it into a practical. And we have to face day to day the new challenges in the practice. And new diseases will come, new manifestations will come, new technologies arises, the technologies with the challenges, and going with the technology is also a tough job. By the same time, the social, psychological, as well as say education level varies. Every 5 years, we can see the changes in the society and the patients. This is by experience I am talking. And whatever yesterday we have learned may not be useful today, or which may be waste tomorrow also. Except the basic things like anatomy, physiology, that won't change. But remaining all the things are changing. And here the senior teacher is there. I remember only the blackboard teaching was there when Dr. Patel sir or I have started our teaching career. Now it is not like that. So many advanced technology. The many students, they attend from Canada, Malaysia, Australia, Germany to see our classes and here. And by the same time, students are also exposed to the so many national and international personalities. Still, I will tell you, a very simple case of acute rhinitis enters in your clinic. I am very sure you are in dilemma. What is to be given? Whether aconite should be given, brainia should be given, belladonna should be given, the dulcamara, or the heparsulf, or L-Cepa, or Euphrasia. Yes or no? Tell me. I challenge. When a person are actually running behind the PhD with a subject like acute rhinitis, means just you can imagine that it is very difficult to take it granted. A city like Bangalore, where we stay here, I know, I think our CS Suranjana sir will agree with me, where yesterday it was rainy season, today it is a summer, and tomorrow it may be a winter. And within 3 days, there will be a change of remedies, change of modalities. There you cannot fix. Yesterday the patient came with a fever and cold, and you thought that he was a hot patient. No, I was thinking to give him some hot remedies. And very evening he calls, you say that, no, I feel very much cold, where I have to cover everything. I cannot tolerate the things. See, this is the change and the challenge for you. Then what you will say? Where you will get an answer? Who will guide you? In the institute you have studied, yeah, we have a very good scope for all these things. And these are all the group of remedies and indication of so and so. Many you are here, you are all scored distinction marks in your degree courses when you are studying, or distinction marks in Mathematica, repertory, or organon, the core subjects of homeopathy, even including repertory. But when the question comes, whether you have to refer the repertory, which book you have to refer, which person you have to ask, and you feel yourself shame to ask someone, your colleagues, that, are so simple case of acute rhinitis, can't you prescribe any remedy? See, the answer will come back to you. Are you sure? I don't know how many you have faced this problem. They find morning where your neighbor knows that you are a doctor, they will bring their child with a abdominal pain, child is crying. Since morning, child has not passed the stool. And what is to be done? You are a doctor for them. Yes or no?
Yes, sir.
Then what is to be done? What remedy should be selected? How it should be known? The child cannot able to talk to you. And mother talks so many unwanted things. Which symptom should be taken? Subjective symptom, objective symptom, or by examination of your findings, or what you note? All these things are true or false. Then you are in dilemma, whether Colocin should be given, or Chamomilla should be given, or Magfos, or Sina, or Spigelia, Magfos. I don't know. You are in a lot of confusion, but you cannot express in front of others. And your parents or your husband or a wife, they think that you are a very good doctor and you have completed 5.5 years of course. Certainly you will give a relief to the child. But you know inside what you are, where you stand, what is to be done. Then from where you will get a confidence to handle such case. Okay, I will tell you one more incident where they brought a lady, pregnant lady, with a 8th month is running, where the of late making a ultrasound scanning or any other so many tests has become a very habitual. Whether it is required or no, that is a different issue, because technology is so advanced. Where scanning has been done, and scanning, they identified that there is a renal calculi in the fetus abdomen. I hope you followed me. Where is the calculi? What, Shilpa?
Fetus, sir.
Fetus kidney. Then patient became anxious. Sonologist there, he wrote all that report and he sent. And gynecologist says that no, we don't have any medicine. Then they started running one after another doctor. Whether you have any medicine, whether this case would be taken, to be treated or not treated. When you are here, doctors, you can open. Dr. Tripti, you can keep their this thing unmute and they can react. It is not like that. It is a one-way journey. That's why I said learning, sharing the knowledge, sharing the experience. Is it a challenge or no? What, Antara, Anushi, Aman, am I right or no? Anju?
Big challenge, sir. Big challenge.
Huh?
Very big challenge.
To be treated or not to be treated?
Sir, I will refer. I will refer to you only. Or one of you.
Whether we have to accept that case or no. And it's really a problem. And naturally, you know, the of late patients or their relatives, they are also anxious. They know that so many things they will start telling her, no, child may get some nephrotic complications, this, that, and it may harm. See, the complications 1 and 1001, they will start telling. And patient is also anxious. So when they thought that congenital anomalies or anything was there, since the 3rd month they were following up, the child was healthy. Everything was normal. Growth was normal. Mother was also healthy. But in this 8th month scanning, this is identified. Interesting, no? This is a practical problem. Then where you will get an answer. Okay? For that time, you can just think. One more thing I will tell you, just to share with you. This is hardly a month back story I will tell you. A 19-year-old girl, their parents brought. Girl is so adamant. She says that I will not attend the exam, PUC examination. I'm talking about this 12th standard. In the different state, they may say different names. The pre-university or the 12th standard examination, public examination, where they have to appear. And this child is supposed to appear for that, the girl. She said, no, I'm not going. And I'm not going to the college to bring the even hall tickets also. I will not appear. Suddenly, she started scolding the parents, not cooperating, not timely food or sleep. There's so many things and always inside the room. And parents are worried. Mother called me, said that I'm worried, sir, the daughter may hang herself or do something harm to her. It went to that level. It's so violent activities. Whether this case should be taken for treatment or no. Parents are worried about the examination. Grandmother is worried about the health of the granddaughter. And her younger brother says that sister has become mad, take to a hospital. And she was a rank holder. And college principal or the class teacher said that better let her appear the next examination, not now. Let her relax, give her treatment. And they took to the psychiatrist. He started some medicine, but she rejected to take. Then that child or girl is in front of me, whether this should be treated or just sent back. And she talks, otherwise they're actually in the house, they talk Kannada, pure Kannada, she talks only English. It is also a typical tone of what we see the English movies in the TVs and other channels. It was a surprise for me because what this girl is talking. She was so adamant. I tried to pull her into the Kannada language. No. She is not at all ready for anything. And what she wants to do, that also she doesn't know. And she doesn't like to cooperate. She doesn't like to study. What will do? And she says that I made an attempt also. She scolds, what doctor, what you can do for me? That was her tone. All these days you are telling me uncle, no, now I are telling doctor. No, you are a doctor. I took an appointment with you. Her tone is completely different. Whether I have to accept this case as a challenge to prove my experience or send back, will they save her from her examination appearing or save her life or save her without all these things? And I'm not very confident because how she rejected the psychiatrist, what the medicine they have prescribed, she has not taken, because after prescription immediately she started checking in the net and she saw that no, this has so many side effects, this, that. And she said, no, I don't like to take any medicine. I don't know, naturally, after prescription, she will ask me also, what you have prescribed, what is the remedy's name? What name you will tell? All our names are poisons only. Is it a challenge or no?
Yes, sir.
Huh? If that child is there, now, I said, you go and ask your teacher. No, she said no. What medicine can be given? What medicine can be given? Only medicine will help.
Gelsemium.
You feel that after prescription of the gelsemium, she will become fine? Are you confident? And if next day something goes wrong at house, you know the teenagers' mentality, then you will blame gelsemium or homeopathy? Or you? Or me? You got my point? The seriousness of the problem. Okay, you can think over. I will share one more. I don't know, Shilpa, how much time I have got now.
It's very serious argument. Very serious, and please tell more something what you will do it actually. You just left us hanging in the situation.
Sir, he will answer it in the DACH course.
Okay.
There another family story I will tell. How much time remains with me, Tripti or Shilpa?
2 minutes, sir.
Huh?
Another 2 minutes.
2 minutes not possible. Because you have changed the schedule without my notice.
Okay, 1 minute, sir. So you can...
That's why I will take another 5 minutes.
Okay, sir, no problem.
You should compensate that.
Sure, sir, sure.
Because they should understand the importance and seriousness of the study, the learning process, why you learn, why you share, why you want to listen to others, why we should not feel that I know everything or I can manage everything, where the limitation comes. It's another family story, just I will put it in front of you. A Marwadi family, stays in Bangalore, from north. Husband has a high blood pressure and diabetes. He had a high suspicion on his wife. Wife is under a lot of pressure because her mother-in-law is not treating her properly. And at the same time, she has another problem, that son is suffering from schizophrenia. And he comes, quarrels, hits the mother, and next moment he makes a lot of love. And grandmother is there. She wants everything in time. Her food, sleep, everything. Nobody should disturb her. And this is the family scene. Who should be treated here? Husband, wife, or that son, or this mother-in-law or grandmother, or husband? Let me know. You got my point, what I'm telling. See, everybody has a problem, and that all the things are there in one home. In house, they are suffering. Who should be treated?
Must be mother, sir.
Yeah.
If you are treating mother only, they feel that she is getting disturbed. and they don't have a confidence on anything, either a doctor, medicine. See, why I asked all these things, maybe the day to day you are also facing all these problems. See, still at this age also I consult so many persons, youngsters, juniors, seniors, to whom I feel that I could able to get some answer. And for that, you have a very good platform here as a institute called NICE. A senior person, one who has got a more than 50 years of practicing experience only, like Dr. B.D. Patel. See, teaching is not an easy job. Still he is teaching, means you should know the love and affection for the teaching as well as sharing the knowledge. And he wants to transfer that knowledge or the experience, what the treasure he has got, to the next generation. See, you are all here, maybe the third generation compared with his age. See, that is the thing where you are getting. And the idea which came in the mind that Dr. Swami thought that, okay, no, there is something is missing. Where at least the few of the doctors or the many doctors, they are facing the practical problem in the clinical practice, then some guidance they may get it by doing the course. Course is just for the namesake. But where to transfer that knowledge to the next generation. See, I remember when we were all students or when we were completed, nobody was there to guide us for IVS, I will tell you. 1 or 2 persons will be there. Yeah, I gave this thuja to this patient, patient became all right. Next question, if you ask, yeah, you go and study Materia Medica. You will understand. That was the answers you used to get. I think Swami also shares with me. Except that you don't. But here, you get each and everything, why you have selected that remedy, how you have approached the patient, and the clinical knowledge, what you get it is abundant. To what so many cases, what just I shared with you, maybe few psychiatric or the surgical or any other orthopedic, gynecology, pediatrics or a psychiatry, whatever the cases, to get an answer where one has to go through certain, though it is a refresher course after the basic course what we have studied, because there also word to by may not be possible. Nobody might have been taught you. But when you started your practice, you started realizing that what practical difficulties you are facing to handle the patients in the society. For that, you will get a clear guidelines through this NICE. Give them a big hand at least with that idea where the course have been started. And many youngsters, they came forward to support and join and continue the interest of the NICE Institute. I hope the next few months you will join. By the same time, you transfer this or you share this knowledge with your friends who are all interested. There is no age bar. I remember for that best example is our Suranjan sir. See, he is many years senior to me. Still, he has got that zeal and interest to study the things. See, the study, the subject is not a barrier. You can ask him. He will explain for that. I hope you will utilize the maximum from the faculty as well as other your friends and join us, be with us in the journey of this learning. Thank you. Thank you very much for giving me an opportunity to share.
Thank you, sir. Thank you, sir, for your for sharing your experience and encouraging the students and the participants to know more about the course and to.
Your volume is low, Trupti.
I said, okay. Can you hear me now, sir? Is it audible? Is it more clear?
Still, you can make it more. It's not audible.
Okay. Now?
Okay, comparatively better.
Thank you, sir. Thank you very much for encouraging words and encouraging the participants who have not enrolled for the course to give it a thought and join the course. Before we go to the next faculty, I request Dr. Anju Jagwani to just share a few words on her experience about her when she joined the Metamorphosis course and how it helped her before and after joining the course. Dr. Anju Jagwani ji.
Shubh Madhyana, Namaste. Good afternoon to one and all. Am I audible?
Yes, yes.
Yes, yes.
Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwara, Guru Sakshat Para Brahma, Tasmay Shri Guruve Namaha. सबसे पहले मैं नमस्ते करूंगी, नमन करूंगी दिल से और शुक्रिया करूंगी डॉक्टर बीडी पटेल सर, डॉक्टर हेगड़े सर, डॉक्टर स्वामी सर. These are all our amazing, renowned and remarkable, so experienced teachers and wonderful pure souls. And myself, Anju Jagwani. After a gap of about 20 years, I wanted to practice homeopathy. And I was thinking what to do. Then I would like to thank Dr. Anusha, who guided me about this Metamorphosis course in 2019. And as the very name Metamorphosis means transformation. So is the course aptly designed, and it is a complete homeopathic science program, certified program with interactive practical learning sessions on how to practice classical homeopathy. And it helped me to bridge the gap of 20 years of my being a student to a practitioner. After completing this course, I got complete clinical knowledge and also confidence to start my own clinic. Still, I need to learn a lot more from our gurus. But I'm very, very thankful that at least it was not only a refresher course for me, but deep insight to clinical learnings, like what right from the patient where comes to our clinic, understanding the case and analyzing, selecting, how to follow up, how to manage the case, about lab investigations and about diet and lifestyle changes. Everything in totality I learned in this. Sorry. And it helped me a lot, and it gave me a confidence. And after that also I attended many nice other courses also, which helped me a lot. Yet I need to learn a lot from my masters, and I'm very, very thankful. And the one thing I learned, that how to be patient with the patients is how to be very, very patient with the patients, and also to be confident and wait after selection of the right remedy. Generally, we also get anxious, like if patient says that I am not getting relief. So we also start anxiety is there. Okay, why? Sometimes we keep changing the medicine. So this thing I learned, that we need to wait. If we have that our medicine selected by us is right, we need to wait. We should not be carried away by the patient's conversation. So these are small things which play a very important role in treating a person as a whole. So many small things I learned, which we face which is very, very important in our clinical practice. Excuse me. And indeed, Metamorphosis is a must for everyone, I would say, who wants to transform themselves and move ahead in the field of homeopathy. And last but not the least, I would like to thank our brilliant and sincere Dr. Tripti Pai and Dr. Shilpa for organizing the programs efficiently. Thank you, NICE team, and I'm grateful to be a part of NICE. Looking forward to more of such programs. Thank you.
Thank you very much, Dr. Anju Jagwani ji. It really makes us feel proud that with the aim that we started this institute, the courses that we designed, and with the aim that we had in our mind, when we hear such wonderful words, we feel that what our vision has been accomplished. And we are really thankful to you for sharing your valuable experience. I now request Dr. Shilpa to introduce our faculty.
Yeah, yes. So it's a matter of privilege to introduce Professor Dr. B.T. Patel, sir, founder, president, and patron of Karnataka Qualified Homeopathic Doctors Association, and also a father figure to most of all the youngsters here. And sir was former principal of Government Homeopathy Medical College and Hospital, Bengaluru, and also Chandigarh, and former director of Vinayaka Mission Homeopathic Medical College, Salem. So sir is almost, he has 50 years of clinical experience. Sir is a multilingualist, wonderful teacher. He's an able administrator, a good and reputed practitioner of classical homeopathy, connected to many national and international bodies of homeopathy and social organizations also, like Rotary and Bharat Vikas Parishad. It is an honor to be under your shade, sir. So I feel our new participants also will benefit, like how we have been benefited through all these years learning from you. So, sir, we would now request you to share a few glimpses of classical homeopathy.
Thank you, Dr. Shilpa ji. Am I audible?
Yes, sir.
I'm audible to everyone? Okay.
Yes, sir.
Well, friends, after listening to Dr. Shripad Hegde, should anyone speak on this issue? That's my view, because what all we wanted to say, he has said it in a very compact compact way. And already the time is from 3:30 to 4:30. Now only some 16 minutes are left. And more than me, chairman is there to speak. And what should I say? Well, friends, when you go back, just see how homeopathy has been transforming into different things. I remember, I'm talking of 1973, 74, 75. At that time, there were only two books. One is Materia Medica, one is Organon. And slowly repertory crept in. And the basic idea, basic method that was practiced everywhere is take the symptom, dawai de do, match the symptoms and give the medicine. And most of the people were starting with 30 potency. If anybody prescribed more than 1 mg, people used to blast him. Kya kar raha hai? What are you doing? You are killing the people. You don't know. But now, as the time has changed, have you seen the methodologies of applying Materia Medica to a patient has changed so many ways? Nobody, I never imagined till 80 or 81 that homeopathy would be fed in the computer. Or Materia Medica will be fed into computer, report will be fed into computer. Before that, only memory was the thing. You remember the symptom, you compare, and you use the medicine. And the application also was so different. I'll share with this. I don't know whether I've shared it earlier or not. When we were teaching in Chandigarh, it's 75, 76, 75, 76. The prescription was more on generalities and then local symptom if possible. Now, one of the first year students, we used to make also in the OPD and practice. She took some case, she gave medicine, maybe within 2 weeks, the case was cured. And the person came and said, he met our director, said, "Kya baat hai, kya doctor sahab, kya clinic hai, bahut badhiya hai ye." I said, what happened? Sir, mere paas na itna bada height, main wo allopathy doctor ke paas gaya. To wo bolte the ki, sir, we have to get it operated. There is no other way immediately, otherwise you will have a lot of problem. Your testis will be crushed. So, sir, I got scared. And I never went for operation. I came to this homeopathic clinic. One lady was sitting in the OPD and I hesitated to show it to her. It was a hydrocele. I said, "Hum kaise dikhaye?" To bole, "मैं doctor हूँ, you show it to me. I'm a doctor. Please don't hesitate, show it to me." And hesitatingly, that man showed her, and it was such a big one. She said, just like coconut. Why she compared with the big coconut is, she was from Kerala, that girl, that lady. So, you know, South Indians and more of Kerala are coconut. Kerala means itself coconut. So she said it was just the size of a big. And I don't know what to do. And because I was sitting in the OPD and I have to learn, I have to prescribe something, and no doctor was available. So I asked him, what is the problem? He said, swelling. Fine. Next, I'm having severe pain. Okay, then when is the pain more? Simple things what have been taught in the first year, second year. She applied that. She said, मैं बैठा हूँ तो ठीक हूँ. मैं अगर थोड़ा उठ के चलूँगा तो दर्द होता. Means when I sit, it's fine, but when I get up and walk, it is paining. As long as I'm walking, it touches both the sides, there is a pain. Again, if I sit down, there is no pain. This lady didn't know what to do. She just prescribed Briannia 30 for 1 week, full. And after 1 week, the pain was reduced, the swelling has come down half. And she said, I will repeat once again. Again, she prescribed Briannia 30 for 1 week. And within 2 weeks, the swelling, pain, everything came down. Can you believe these things can happen? So then we asked her, what made you prescribe Briannia for hydrocele? If you go and check up in the repertory or in the Materia Medica, Briannia has never produced hydrocele in its Materia Medica. And when we asked her, what was that which guided you to prescribe Briannia? She simply said 2 things. Sir, because I don't know much about Materia Medica, or I only read first year, second, a few drugs. But you were telling always generalities can be applied to physicals. Physicals may not apply to generalities, but generalities can be applied to physicals, especially if there is a modality. Any symptom, any general symptom, modalities can be applied to physicals. And I did that. I said, what? I said, how? What was the modality? You took it. She said, sir, movement, aggravation, rest, amelioration. I said, yeah, kya baat kar rahe ho? This is a common sense. Naturally, when there is a swelling, when there is a pain, when you move, it will be pain. Sir, I don't know anything. I prescribed that and work. Now, this is one. These are the things that happen in homeopathy. That what symptom, what indication, what methodology strikes at the case, we are not sure. That is the reason we always need to keep on listening, keep on learning, keep on studying, keep on understanding, and keep on exploring the system. It's not like your allopathy. Once you finish the college, the medical representatives will tell you how to do a general practice. You need not bother. You don't need to update also your knowledge. Every new medicine comes and that medicine will be told and you prescribe, except for surgeries and other interventional fields. And we are generally general practitioners. We don't do surgery much and all that. So we come on the general. But we need to study. We need to update ourselves every day, every moment. Anything, anywhere, what we get from that, we don't know. Now you see, Briannia curing a hydrocele. Like this, we can keep on giving you a lot of things. What the patient expects, what the doctor expects, and what the result comes out may be entirely different. So friends, constant learning. Every time, see now it is said in Vedas, Brahmachari, you should be a Brahmachari. Brahmachari means people understand in a different way that you are a celibacy. That is the wrong and the worst explanation of brahmacharya. Brahmacharya means, Brahma means knowledge. Charya means learning. So knowledge you need to keep on acquiring. So such courses will upgrade, will give new ideas, or you will be sometimes surprised. I could never think like this. As this happened to us in the heterosexual case, we can never think. If we would have been there, we should have some rhododendron or conium or something else, which are only what you call diagnostic symptoms or organic symptoms, organic remedies or diagnostic remedies. But this Brahmya curing hydrocele, just on simple modality, is a new learning, even for us, for anybody. Whether it is we are in 50 years or we are 40 years, it makes no difference. That is the reason I make it a point, as far as possible, whenever we get time, anybody is speaking on homeopathy, we would like to listen. You see, many people think in a different angles. Sometimes anything what you listen, if you apply in some case, and that helps the patient, it is worth doing it, and that is the payment what you get. Suppose you pay some money and learn all these things. One patient, if you cure with the knowledge you acquire in this course, that itself will give you satisfaction, and that will be go on. Now see, some of the cases I was just listening to somebody. One case of asthma, at one incidence, it was helped by Staphysagria. At another incidence, it was helped by Nux vomica. At the other incident, same asthmatic attack was helped by Platina. Can we all think, generally, can we think of these remedies in asthma? Hardly anybody thinks. The moment a case of asthma comes, arsenical pehla, epicock, pulsatilla, rustox, something like that, even Brahmya sometimes. So many other things, antimtart, all this thing. But can you think of Staphysagria? Can you think of Platina? Can you think of Nux vomica? Nux vomica, yes, sometimes we say. Can you think like this is what knowledge you gain when you keep on listening to different type of people. Experience may not matter much, but the approach matters. Now we have seen earlier, as I told you, it was only a book repertory you used to refer. Today you have computer. You can repertorize one case, putting all the repertories together, and so many repertories have come, which we have not even heard, and which everything, some new drug. For example, how many of us really have used bambusa? Have you ever heard the remedy bambusa? How many of us have used it? How many of us have done it? Such courses make us, or they expose us to so many things where the knowledge can add to us so that it may be applied to the patients. And if the patient gets better, especially with homeopathy, it's an excellent feeling the patient feels as well as you feel. Now, yesterday I was addressing the freshers in Anuradha College. Believe me, the staff, the students were amazed at the presentation. So many things we could never imagine when we joined this college. As some doctor, we have to become some doctor. Doctor banna hai. All the girls have joined because for the marriage, an IT fellow will ask, IT or a doctor, so there will be no dowry. Okay, or I'll get a very good husband if I am a doctor. Are koi doctor ho, whether it is homeopathy or Ayurveda or naturopathy or even acupuncture. That's the idea. But when they heard it, I told this is not that simple thing. You are here to get so many things. Only thing you have to put up your mind, study hard, show interest, accept homeopathy, and then you will explore the world. You can be much better, big practitioner when compared to your other competitors. It depends upon how much hard work you put, how concentratingly you listen to the speakers, teachers, and apply it, work hard, go home, and again keep on remembering it. What you call is nemare harpadu. Keep on chewing it back, just like the cow does. It takes grass, eats, and it sits. It's keep on bringing it on, bringing back, chewing it, swelling it. So each drug, whether it is aconite, simple drug, or it may be very complicated drug of something, one girl came and talked about lizard as a medicine. Okay, 2.5 hours she wasted our program and she prescribed lizard, and that is not available anywhere. So I'm not talking of that. Any drug, any medicine, any case that comes, if we pay attention, if we think how we can relieve the problem from different angles, many new things will come up. And such things will be easier when you attend such courses where people talk from different experiences. Their own experience. And because here we are not bound by anybody, we can go into all the details, forgetting about syllabus. In the college, most of the time, we are concentrating on syllabus and the time frame, jaldi jaldi khatam karo and bhago, right? Something is, see, you just mug up everything, and on the question paper, you vomit and come back. After vomiting, after you passing, you asked, what did you answer for that question? Arey maar goli yaar, chod, leave that. I have passed now. I am a BHMS and now I am applying for MD. So that attitude will not help. Here, it will make you a real homeopath. Means the way you think should be homeopathic thinking. Everything you have to think in a different angles. Okay, now we have so many repertories, we have so many new drugs coming up, and everything we can't remember. Sometimes, now I told you bambusa, drug bambusa. And I was seeing so many new drugs where if you make me to sit in the first year Viva and ask question, I will get 0 marks. The material has grown so much and so many symptoms, how can you remember? So we need repertory, proper use of repertory, proper application of repertory. Repertory is just like mathematics, calculator. You put the symptom, you get the drug. That's not there. The art is different, the science is different. And mechanics are different. Art, science, mechanics of repertory are totally different. You need to utilize repertory, amalgamating all these things. Art, first mechanics, science, then art. And the result would be some patient will be benefited. It's not the money what you get. When the patient says, sir, you gave medicine and I'm feeling very happy, sir. I'm very much relieved. That smile, that satisfaction will be much more than what you receive as the payment. So friends, let's hope in this 80 hours of what the super faculty has formulated, it is for them it is very easy. Dr. Patel will take this topic, you will take this topic, and I have to break my head and to give the first lecture I'm preparing for the last 1 month. I don't know how it will be. But see, that makes me also to work. They don't have a pity and mercy. They give some topic and I have to work and on that. And that makes me work. Yes, I'll work. Something good may come out. Something I learn, something we learn. And what I would feel is, at least there should be half an hour for discussion, 2 hours of conveying whatever we want to convey, and 30 minutes of thorough discussion. Do you agree, super faculty?
Yes, sir.
Yes, sir. Yes, sir.
Yes, sir. We'll do that, sir.
Okay. Now the time is up. 4:30 is over. Now whatever time, remaining time, everything you give to chairman. Let him speak for 2 hours. Okay.
Thank you,
now,
sir.
Time was 3:30 to 4:30, na?
Yes, sir.
Yes. So I would not like to go into the depth. Many more things you can keep on talking. Being a lecturer, since Sripad Hegde has spoke, for me, he can speak. And above, when compared to Sripad Hegde ji and myself, our chairman is superhero. He can speak for 2 hours, pata nahi kya bolega. Okay, back to you, Shilpa.
Thank you, sir. Thank you for all those words of wisdom that you shared with us, sir. And hoping that next 8 years we'll all be fully engaged with your sessions. I would now, 1 second. Okay. I think most of you all know Dr. Swami sir, but for the formality of introducing the faculty, I take this opportunity to introduce my mentor, Professor Dr. H.L. Swami sir. He is the founder and director of National Institute of Clinical Excellence, chairman of Karnataka Qualified Homeopathic Doctors Association, professor at Bhagwan Buddha Homeopathic Medical College, Bengaluru, former principal of Anuradha Homeopathic Medical College, Bengaluru. He's been practicing homeopathy since last 30 years, been an eminent speaker at national and international seminars and webinars, published several scientific articles in various journals. And as one of the doctors, Dr. Archana said, what sir has taught in his theory classes, we could get to see in his clinic. So it is, I always usually when I get a chance to introduce sir, I keep telling what sir teaches, he practices, and what he practices, he teaches. And most of us who have been attending his classes know his zeal and passion towards teaching. And that itself has brought all of us under one roof. And we've been running from 2013 till now. So, sir, with this very, very, very short introduction, we would like to hear from you, sir.
Thank you, Shilpa. Thank you very much for so many big words. I don't know, I'm not, it's worth for me or not. As Patel sir was telling, after Dr. Shripad Hegde sir and Patel sir spoke, I don't know how much really I can speak. And sir already told, so for 2 hours for me. So before even I start, people will have started exiting. So yeah, I may speak for 2 hours. It is not that way. Okay. So Trupti, just wait. Huh? Okay, wait, Trupti. Okay. So actually, I just take a minute or two before today's this thing I speak. Actually, as both our some teachers, sirs told, Hegde sir and Patel sir, what we learn in the college, and at that time, the learning is only to pass. So immediate this thing is to examination and how to score, how to pass. That will be the aim. See, very purpose of starting this institute way back in 2013, 2010, 11, 12 at that time. After I left my GHMC and joined Bhagwan Buddha College, a lot of GHMC students started asking, because by that time they finished the course, they started practice. Only after jumping into the water only they know how much cold and how much deep it is. So they used to talk, sir, they're all good and ranked students in the college, but when they come and sit in the clinic, sir, we are always start confusing what to give, all look similar, and what patient talks and whatever we studied in Metamorphosis. So what to do? So which book to read? So usually they used to ask, so what to read? I used to tell 1 or 2 books, you read this, you read that and all. So, but again, when they ask with very enthusiasm. After a day or two, again, I'm telling the same books, which already they studied. Again, I have to read Kent Organon, principles, practice of principles of the organ of medicine, homeopathy by Kent. So Cesar is also telling the same thing, already I read. So they used to feel that one. And they did not know what to read and how to this thing. And I used to tell that you attend some, at that time, these seminars and classes were not so much. So they used to go and attend. The majority of the seminars, workshops used to happen with a new homeopathy. Some founder used to start in his banner or her banner, and they used to tell that this is the only right homeopathy. So they used to get more confused. They used to come and ask me, sir, we got more confused now. And I even saw a few of my friends and juniors who used to practice this polypharmacy or the over-the-counter medicines. I used to ask, why you are doing it? So they tell, no, it is, it's very difficult to do this thing. It is different when talking in the class, but when he's applying, it is not possible. At least this, for fever, some Q3, some fever quick remedies. For renal stone, some stone, this thing. So all combinations. So fortunately, immediately after my studies, graduation, or during graduation itself, I had my mentor, Dr. B.D. Patel, sir, I had an opportunity to go and sit in his clinic. We used to see how the medicine, single medicines, how the homeopathic medicines used to work. We never thought of even thinking, even in our dreams, about the using the combinations or the whatever over-the-counter medicines or the that type of drugs or the allopathy. But same thing when I used to tell about my students or my juniors, they used to always ask. And I thought, okay, they need this finishing course. This is what I used to call it. So it's like a finishing course where you know the subject, but applicability of the subject was missing. So with that thought and regular pressurizing from the students like Dr. Shilpa and others, so they compelled me to start this course. After that first batch with a very, I think, Shilpa, it may be around 8-10 members. So, but each batch started increasing, more and more students are joining, and they started giving the feedback, sir, it's really helped us and all that one. So it makes us to think and make it regular, this thing. When I started, I thought maybe it is only for one batch. So because Shilpa was behind me, I wanted to finish this and forget. But it did not happen. So it just continued. Today we are at the 6th batch of the Metamorphosis. So, I mean, on this day, I thought of remembering all those, this thing and why we started, the very purpose of it. So even not only the freshers, even the practitioners who are practicing since long time, they also fixed the routine. It is not the knowledge of the hard work or too much of studying. The more difficulty is not knowing the new thing. The difficulty is stopping what we know, which is not giving us results. That is very difficult. Whatever habits we have, so cutting these habits and easy ways, shortcuts, that is a big problem. When you attend this type of seminars, classes, workshops, so at least you start thinking, yes, so this routinism is not right. Less shortcuts is not this thing. Okay, there is other way of thinking. See, for a very successful homeopathic doctor, you should be open in your approach. Whatever the right way of approach, and every case needs sometimes may require a different approach. Not that every case requires a complete case taking, only on mental symptoms, only on physical genitals, as sir was beautifully giving one example of bryonia. So we never think of hydrosil treating with a bryonia. And just because she is unprejudiced, she gave it. If I would have been there, definitely I would have not given the bryonia because I'm prejudiced. Already I know bryonia doesn't work on this type of this thing. Bryonia is acute medicine. Bryonia is a plant-based medicine. See, we are prejudiced. For these prejudice to come out of these prejudice, we require this type of classes. Otherwise, we are routine. We become, as Sir was also telling, Hegde sir was telling, moment it is a fever, we think only aconite, what to give, this thing, aconite, bryonia, love on this thing. To cut out of that and think out of the box. It is always very important, especially for a homeopath. Okay? So many times, this nosological diagnosis, it has a both impact. It is a good and bad for homeopath. Sometimes knowing a nosological this thing, that girl did not understand what is hydrosil, that's why she gave bryonia. If she would have understood that surgery, she would have finished surgery class, she would have not given bryonia. Here, not knowing is a blessing. Sometimes knowing the nosology is a blessing. You should know. At that time, you should see, when you know that, still you think out of the box. That is See, that girl give it because she did not know it. But for you, it is not like that. You know, but still, your mind should start thinking it is not only the hydrocele drugs. Then you will become a better homeopath. To cut out of these what you call our chains, it requires a motivation. It requires a regular this thing. So a seniors like Patel sir, Hegde sir is always there, and I will also be there. We will always there for you, not only in the class, not only for that topic or subject, even out of that, in your cases, or once you start your established your clinic, at any time you can call us and ask, sir, we stuck here, what to do? So we are always there. We are always there to guide. It is not like sir has told, there is no syllabus, fixed syllabus. It is only for our convenience we made this framework. Otherwise, it is very fluid. It is more of learning from cases, from clinical point of view, we start learning in this course. Okay. So in this context, I thought today I selected a topic where is it the lab investigation is required for homeopath or not required for homeopath. Okay, Trupti, you can now start sharing these slides. So I seen, as Hegde sir was also telling, when we started our practice, even Patel sir was telling, the system is very, very simple. So there was so many homeopathic doctors, they took this homeopathy as like a religion, may not be a qualified also, but still they used to take this one. And I seen the homeopaths who used to feel proud telling that I'm practicing last 25 years, I never touched the stethoscope. Mister, what is that? Is it a so bad thing to use stethoscope? I never checked the BP. I am giving that the prescription with this one. So I seen that extreme also, where people used to forget about sending the laboratory this thing, even prescribe testing with their steth and BP apparatus. So prejudice. And I seen other extreme also, where people, most of my students, they call and ask, sir, I have osteoarthritis case, what I should give? Or they will tell seronegative, sir, say CRP is so much, and this one is so much, what to give? Both extreme. They want the prescription on the basis of just on the pathological report or the lab report. On the other one, where they totally condemn, they tell that you should not use at all. So, as a practitioner, even in your practice, you have this dilemma. Should I order? Should I not order? If at all, if I order, what are the investigation I should order? When to order which investigation? How to take those reports into our confidence? Is there any role of lab test in the classical homeopathy? Okay, all these things you are going to learn in the next coming classes. But as a glimpse, I wanted to give this topic today, role of lab test in the homeopathy. Okay, as I was telling, next slide. With an example of one case, I'll just start this one. Okay, a friend, homeopath, he was almost similar experienced homeopath, like, I mean, the last 30 years he was practicing. He called on early hours of a day, around I think 4 or 5 o'clock, he called me and he was asking for a help, as his wife had a fever, severe chills, body pain, especially low back, severe pain, since previous afternoon, evenings. So she was requiring several blankets. He was to tell, all my blankets in my house are already put on her, but still the chills are not reducing. Her hands and legs are become so cold. Literally, she was shivering. You can hear the chattering of her teeth. That much shivering she had. So he gave some medicine, and which did not help. So he called me. So in this case, what you would have given? What do you think? What do you think? You have to speak out. I think After the lunch, this is the problem. I think
Syncona.
people will be sleeping. Huh? Yes,
Syncona,
yes.
sir.
Syncona. Wow,
Yes.
good. Syncona. Syncona optionalis. Good, good, good. And on what basis, Dr. Neha?
Fever with.
Chills.
Yes, sir.
Okay, very good, very good. Syncona. Any other? Anybody else? Or any other question should be asked? Anything else?
The thirst of the patient can be asked.
Very good. Thirst of the patient should be asked. So next slide. What are the things I asked? It is there. Okay, next slide. Shilpa, Trupti, I think, I don't know who is operating. So I asked, this happened last year in the same time. No, you go to the next one. Last year in the same time, this happened. It was a COVID time, second wave. It's a peak time. You know, all around April, May last year, how COVID second wave was this thing. So immediately I asked, she had any cold cough. Okay. He told the no cold, no cough, only headache is there. That is also mild, this thing, but lot of weakness, no thirst. I asked generally thermals, what are these things? He told she is sensitive to both heat and cold, but more towards the heat. She cannot bear too much of heat, this thing, but both extremes are there. Both are this thing. Okay. He already started with homeopathic medicine, this thing without much help. He told that he was giving from last evening, he is repeating the medicines. He is giving that medicine without much help. In beginning, he felt little better, but again fell back. Okay. So now tell me, which are the medicines? So what medicine you can tell them? Huh?
So Apis.
Apis, because thirstless. Only Apis is thirstless?
No, sir, Pulsatilla is also thirstless.
Pulsatilla also. Here thirst, he told there is no marked thirst, but during the fever stage, she asked some water. Okay? No marked thirst. Good. Pulsatilla also thirstless. Very good. Next. Any other remedies you can suggest them? You are asking what to give now. Okay. Before, I think Merxa. Very good, sir. Merxa, Subaranjana, sir. Okay. Next.
So carbo vegetables.
Carbo veg, because hands and colds, legs are cold.
Cold.
Okay. Yeah. Next.
Arsal,
because it's the season, COVID season. Huh?
Yes.
Okay. Then Sepia, Archana, good. Sepia, very good. Sepia, on what basis, Archana? Okay. Any other remedy you want to suggest?
She is Dr. Archana Punjabi or different Archana?
Archana Bhatt.
Archana Bhatt.
Okay. Because you say Archana the moment I was shocked. See, Archana Punjabi is in a very dire condition now.
So it's Archana Chickmat, sir, not Archana Bhatt, sir.
Okay. Sorry. Archana. I thought one. Okay. Archana,
weakness, thirstless, and chilly patients.
Okay. Next.
Thank you.
So should we not ask what the previous medicine he given before suggesting other things? So I asked, what is the medicine you gave? He prescribed gelsemium, which is almost similar, no? It is almost similar. So gelsemium covers for shivering, chills, so many blankets on this thing, cold, extremities. and not so thirsty also. But even in spite of repeated dose of gel-sewing, it was not helping. So now, what we should give? It helped in beginning, then no. So next slide. So what I advise for a basic lab test. Basic, just HPTC-DC ESR because of her age, RBS, and urine protein. Okay. So he was expecting me to tell the remedy, but I told in the moment I asked, you sent for a test, he told no COVID test. Already she took one COVID vaccine, one dose of COVID vaccine, no COVID test. Because at that time they are so much scared. The moment it come positive, these people used to come in front of their house for quarantining. Okay, then I told no, not COVID one. I just this thing only. Okay, next slide. By noon, we got the results, test reports. So HBTC, DCES, and these things are within normal limits, except ESR marginally raised. Okay, it was around 28. But urine was turbid, plenty of pus cells, and lot of epithelial cells also. Now you tell me what you will advise.
Cantheris. Urinary tract infection.
See, well, see, she did not have any urinary complaints, no burning micturition, nothing, no urinary this thing. But at that time, because of the this thing, epidemic, the one, pandemic, it was all mimicking the same this one. This is where it is homeopathy plays a different role. If it is the conventional this one, they just would have put the all antiviral, this thing, they would have sent. Okay. So what I think Preeti Kulkarni, no?
Yes, sir.
Who answered? Preeti Kulkarni only answered no.
Yes, sir.
Yeah. Yes. What Preeti Kulkarni told, same thing I told. Give Cantheris few doses. To our surprise, by the evening, the patient was fine. She was on her feet, started this thing. So why I told is, so many times we have prejudice, no? So with whenever the exact symptoms we get, so we think that has to act. If they're not acting, so homeopathy may not act. It is not like that one. You go and read Cantheris fever in Clark Metamedica, you will get all these symptoms was there. You got it? You thought of Cantheris because there was a UTIs. The report came as because of the pus cells. Otherwise, you would have not thought. See, even we are so much conditioned with your remedies. You go and read, as Sir was telling, it is human brain is not this one to remember all the symptoms of all the drugs. Okay, so even rubberized you will get Cantheris, but to think of Cantheris, you required this one. So these lab tests, it's not only important for the allopathy, even it's important for us, even for the selecting the remedies, even for a classical homeopath also it's required. Not only for that, even it is required for to know the pathology, to know the prognosis, to know the miasm. For all these things, we are going to learn in the next coming classes. So how the role of lab investigations will help us to identify the miasm, to give for the second prescription, follow-up remedies, prognosis, those things in detail we are going to learn in our next future classes. Dr. Shilpa, I have time. Dr. Trupti, if you have time, I'll take one more case. Otherwise,
sir, we are almost close, sir.
Close, no? So enough. One class is enough. So that in the next future classes, we'll continue our journey of understanding the wonderful efficacies of homeopathic medicines. Homeopathy is not a rocket science. It is simple. Only thing is, to be simple is difficult. To think simple is a difficulty. Okay? So, we'll started the journey. I look forward for our future interactions, classes. Even I am open to learn from all of you. Thank you. Thanks for the opportunity.
Thank you, sir.
We are supposed to quit now.
Yes. Somebody wanted to talk.
Patel sir asked.
No, yes, we are supposed to quit now.
We will quickly introduce the coordinators and then we will close, sir.
So I wanted to ask you one question of yours.
Yes, Dr. Neha. Go ahead.
Sir, if in the last case what you have discussed of UTI, if we would have given APIS, then would it go in that case? Because again,
see, you would have thought of APIS, you would have thought of Sepia.
Yes, sir.
All these things also you would have covered. I'm not saying no. Okay?
Yes, sir. Okay. Thank you, sir.
No, I wanted to show the role of lab reports in selecting the remedies.
Remedy. Okay, sir. Thank you, sir.
Over to you, Dr. Trupti.
Yeah. Thank you, Swami sir, for elaborating on the importance of lab investigations, and more of such things we will be learning in the next 80 hours during our course. So throughout the course, the coordinators of NICE Institute will be Dr. Shilpa Ji, Dr. Trupti Pai, Dr. Anusha Matthew, and Dr. Antara Chatterjee Bandopadhyay. The contact numbers are on the screen. So you all can contact any one of us to know about the course, and those who have not registered, the registrations are still open. So to know more details about the course and the registration process, you all can WhatsApp or call any one of us. You all can also email us at pgnice2020@gmail.com. To know more about our institute and the courses, you all can also check our website www.nicehomeopathy.com. I hope you all have the numbers of Dr. Trupti and Dr. Shilpa. I put it on the chat box. You all can take a screenshot or take a photo of this page so that you all can contact us after this orientation. For registrations, please call us. As I said, registrations are still open. And next slide, Dr. Shilpa.
Trupti, little loud. Your voice, as Agnes are telling, little low.
Then I'm too close to the mic today. For some reason, there's some issue with my internet or laptop.
I'll take over, Dr. Trupti.
Yeah, please.
Thank you, Dr. Shilpa.
Yeah. So we will just wind up this session with a small quote which says, if you are not willing to learn, no one can help you. If you are determined to learn, no one can stop you. And all throughout 1.5 hours, what we spent today, all our faculty have been again and again telling the same thing. So let us all become unstoppable with our strong determination to learn new things about homeopathy, and let all of us work towards the path of betterment and bring laurels to homeopathy. And any queries, any confusions or anything regarding the timetable, whatever I shared, anything you have, you can either send it through WhatsApp, or you can just ask in maybe 1 or 2 minutes. If anybody has any questions or any these things, it is still open.
I think Shilpa, you can ask them to direct message to you.
Yeah.
Or talk to you. You are Trupti, all Antara, Anusha. That will be better. Okay.
Yes. So, Dr. Trupti, over to you.
Now, am I audible?
Yes.
Yes.
Okay.
Come with bang.
Yeah, I'm trying to talk a little more louder so that, I'm much more audible. Okay. Thank you everyone for joining the orientation course. And I'm sure that many those who have attended but have not registered would have got a glimpse of what they are going to expect in the next 6 to 8 months or in the next 80 hours of our course, that is Diploma in Classical Homeopathy. And I thank Professor Dr. B.D. Patel, sir, Professor Dr. Shripad Hegde, sir, Professor Dr. H.L. Swami, sir, then Dr. Anju Jagwani, Dr. Archana Bhatt for the live testimonials that they have given and shared their experience. And as all the faculties spoke and they have shared their experience and they said, you all would have got an idea, a glimpse of what you all can expect in the next 80 hours. So make sure we assure you that you all will not lose anything. Remember, knowledge gained is always helpful. Even the smallest knowledge that you all gain, you will never lose anything in life. So we assure you that your clinicals will definitely become strong and you all will not be disappointed after the course. In fact, you all will look forward for more and more workshops and courses from our institute. And as Dr. Shilpa said, that our faculty is not only Swami sir, but even the other faculties also, they practice what they preach and they preach what they practice. So whatever we preach in our institute, we make sure that that is what is delivered. So looking forward to see all of you in our upcoming course of Diploma in Advanced Classical Homeopathy, which will start from June 1st, every Wednesday at 2:30 p.m. And if there are any questions, any queries, you all can WhatsApp either me or Dr. Shilpa, or you can even directly call us. We will be always there to answer your queries. And looking forward to see you all in the course. Thank you very much.
Thank you, Dr. Tripti. Thank you, everybody. We will close the session for now.
Yes.
Thank you.
Shubharatri.
Shubharatri.
Thank you.
Thank you.
Because you don't want to see my dirty goals again. So right now, Shubharatri.
Sir, we'll begin the new month with you itself, sir. 1st June.
क्या बात है यार, ऐसे मत बोला कर उधर.
Thank you.
Thank you.
Thank you.